icon. Are we live here?
This is for recording. If you want,
okay.
If you want to talk loud, you're good.
I'll make sure and talk loud. Okay. So my name's Sam North. I'm with Mountain Star. We do have a hospital here. Brigham City is one of our hospitals. I'm in charge of kind of all of our health plan, employer outreach type stuff. And we've been kind of working with the county and Jenica on the wellness program, and we're going to kind of take over an aspect of that and help them out and do something that along those lines. One of the things that came up in those discussions, and you may have seen some commercials or billboards about it, is our virtual urgent care. And so Jenica asked me to come and take a little bit of time today to just kind of show you guys what that is, kind of train you on how to set up an account if that's something that you're interested in using. So we're just going to go over that today. You can access it just on your on a regular computer, just mountainstar.com/virtual care, and you can go that route. I think the app is the easiest way to do it because, well, we'll get into that. So let's take a look at this right now. Has anyone seen a commercial or a billboard for that? Okay, a couple hands, couple heads nodding. Jenica mentioned that there is kind of in Brigham City, are there no urgent cares here? There's one, okay. So this might be useful for some of you that live here in the area. We're gonna jump right into it. So, and you can even follow, if you've got a phone on you and you want to do this, to set up an account is absolutely free. Now to use this, I don't want to do that. Great. Just up front, so you know, this is completely separate of insurance. This is not built through, this is just like a retail type thing. It costs $49.99 to use it per use. So it's just like an office visit. Obviously it's a lot cheaper than an urgent care visit. Those of you who have had to do that know that that's about $150 if you have to go access urgent care. Okay, can everybody see that okay up there? So as you get into the app, this is what it'll look like. And it will ask you in your account information up here to input credit card information so that when you go to actually use this and want to see a physician, you're not having to go through that. So you go to your account, My Accounts, and you can enter your credit card information. But we're not necessarily worried about that right now. So the first thing that you want to do when you get into the app or get into it on your computer is go to My Health, and it's going to be like you're walking through the doors of a normal physician's office. You're going to have to fill out your medical history, and it's going to ask you about prior surgeries, allergies, all the same type of things. Now, if you're creating the account, and you have children that you might be using this for, you don't have to create a separate account for every person. You can add them as a dependent under My Account information, and you will fill out all this same information for each person, each individual in your family. So that way when you log in and you want to try and see a physician on here, you can just select, okay, this is for myself, and it will pull up your medical history, or if it's for your spouse or for your child, you can select who the visit is for, and it will pull that up for them. So you fill that information out, then you want to go ahead and click over here to the next tab along the bottom and put in your pharmacy information. Because if the doctor is writing you a prescription, which they can do on here, they can automatically send that to your pharmacy, whichever one is closest to you. Then there's a tab along the bottom there, providers. You can input your primary care physician information. So if there are notes from the visit that you have that you want to go to your primary care physician, you can have it input in there and they can send those notes over to your physician. Then moving along the bottom again, for visits, and there are no visits on this test account, but this would log all of your visits. So if you saw a physician on here last year, and you couldn't remember the prescription drug that he wrote for you, or you couldn't remember what he told you to do, you could go on here and it would keep all your visits, and you could go back and see what the notes were from that. Any questions on that? So those are all the things that when you create an account, if this is something that you're interested in using, I would recommend going in and doing all this as soon as you can so that you have it all set up so that if it's an urgent type visit, you can log on here and just be in front of a physician as soon as possible and not have to fill out this information. Because it's just like a physician's office, they're gonna want all your medical history. Any questions on that? Okay. So I'll show you how this works here.
How often do you have to update your medical history? I know when you go into a physician, if they haven't seen you in 6 months, they're like, I have to all the time.
Fill it out. This account is really, there's nobody going to be following up, so that's up to you. You can update it. I would just recommend it when anything changes that you update it yourself. The physician, I would imagine, would probably ask you, has there anything been updated or changed that's not on your medical history? But no one will be following up and saying, hey, bugging you to change your medical history. So, see if the internet will. Okay. So now we're into, these are the physicians that are on here right now. So one kind of nice thing is you can see these 3 that are available right now are actually currently with a patient. If you can schedule appointments on here, and I've had the question, well, if I schedule an appointment with a physician, is it actually in his office or is it on here? If you schedule an appointment with a physician, it is through this app. So if you schedule, for example, Dr. Brett Blazer right there at 2 o'clock, if you schedule that appointment, you will then get back onto the app to see Dr. Blazer. You won't go to his office. And just so you know, every physician that is on here is a licensed physician in Utah, but that doesn't mean that they're all located in Utah. So all the ones that you see that say Mountain Star Healthcare, those are our employed physicians, and obviously they have offices here in Utah. But some of these other physicians, they could be in Florida, they could be in Texas, but they are all licensed MD physicians in Utah. That's one of the requirements they have to have to be a part of this. I'm going to click just here on Dr. Jenkins, well, as soon as it stops loading, just because he's my personal physician. So I know he won't care if I pick on him. But if you click on the physician, you can go in and read about him. It'll show the times that he's available. It'll show if they're available by video or by phone, because you don't have to do it by video. You can do it just like a kind of the tele-nurse, tele-doc thing and do it over the phone. Obviously, if there are things that you want to show the physician, it's going to be nice to have it and do it over video. One of my colleagues had some rash show up that he didn't know what it was, and so he got on here and then showed the doctor, and the doctor said, yep, I know what that is, wrote him a prescription cream, sent it to his pharmacy, and got it taken care of. Any questions? Okay.